Hello everyone. Welcome to Apothecary Tales, the basics of pharmacology. Today, in this video, we'll be discussing the important patient counseling aspects of diabetes mellitus. We know that in patient counseling, it is important for us to advise on the lifestyle modifications, pharmacotherapy parameters, and so on. Patients should be explained that the disease is a lifelong condition, progressive in nature, and needs necessary modifications in the lifestyle pattern. And we should emphasize on the importance of taking the medications and the need for compliance with the prescribed medication. So when we talk about the lifestyle modifications, we have to mainly look into the dietary modifications, the exercises that should be followed, the smoking and alcohol restrictions or advices. I'll be doing this patient counseling video in different parts. So in this part of the video, I'll be mainly talking about the dietary aspects or dietary modifications that we have to look into while we are diabetic. So kindly be patient and let's look into the important concepts that we have to follow when we are diabetic. So let's start with the dietary considerations. So we are going to mainly focus on the carbohydrate, fiber and the fat content, or what are the different advices on these three parameters in the diabetic diet. We know that carbohydrate is a major source of glucose or sugar in the body. So let's see how we have to take precautions or how we have to limit the intake of carbohydrate in the human body. The carbohydrate intake should be fairly constant and the amount given should be appropriate to the level of physical activity in the diabetic patient. For the young individuals, it is usually 180 gram per day, and for the elderly population, it is usually 100 gram per day. And 45 to 65% of daily calories should be from the carbohydrates. Now, the carbohydrates can be classified into simple carbohydrates, complex carbohydrates. Simple carbohydrates mainly include the sugars, which are naturally present in the food and beverages in the form of like whole fruit, juice, milk, products and honey or processed food. Whereas complex carbohydrates include the starch and fibers. Starch usually takes a longer time to digest, and talking about the fibers, it doesn't digest at all. So therefore the complex carbohydrates will delay the absorption and thereby controls the blood glucose level. When we specifically talk about fibers, there are two properties for it. One thing, it is physically bulky and thereby increases the satiety in the individual. Second thing, it delays the digestion and absorption of the complex carbohydrates, thereby contributing less to the overall blood glucose level. Now let's see what all can be included in the diabetic diet. First, the green leafy vegetables. They are the high source of potassium, vitamin E, calcium, at the same time protein and fiber. As we have already seen, fiber will reduce the digestion or delays the absorption of the other complex carbohydrate. So the different sources of green leafy vegetables might include spinach, kale, cabbage, broccoli, bok choy, collard green. Next is the whole grains, which is high in fiber content and basically include the brown rice, whole grain bread, whole grain pasta, quinoa, millet. Next item is the fatty fish. We know that fatty fish means they are very rich in omega-3 fatty acids, particularly the eicosapentaenoic acid and docosahexaenoic acid. So taking fatty fish particularly in the gravy or the curry form is very helpful in the diabetic patient. So we can include fish like salmon, mackerel, sardines, albacore tuna. Next is the beans, which usually lies on the low side of the glycemic index scale, And not only that, they have high content of soluble fiber, rich in iron, potassium and magnesium. The other thing we can include in the diabetic diet is the walnuts, which is rich in omega-3 fatty acids like alpha-linoleic acid, as well as they are rich in iron, vitamin B6 and magnesium. Another important thing is the citrus fruit, which is mainly rich in flavonoid antioxidants like hesperidin and naringin. So this basically exhibits the anti-diabetic property. Apart from this, it is also rich in vitamin C, folate and potassium. We can include oranges, grapefruits, lemon in the diabetic diet, which helps reduce the oxidative stress associated with diabetes. The next important thing is berries. Just like the citrus fruits, they are rich in antioxidants, thereby reducing the oxidative stress. Apart from that, they are also rich in vitamin C, vitamin K, manganese and potassium. We can include blueberries, blackberries, strawberries and raspberries in the diabetic diet. Next, we can include the sweet potatoes in the diet. They are having very low glycemic index with good source of fiber. They release sugar more slowly and do not raise the blood sugar as much. Apart from these, it also consists of vitamin A, vitamin C and potassium. Talking about another antioxidant, chia seeds is another important thing that can be included in the diabetic diet. It is also rich in omega-3 fatty acids, thereby helps in managing the weight much more efficiently. Including probiotic yogurt in the diet regularly is one another way of combating or controlling the diabetes mellitus, because it helps in the gut health and improve digestion and also reduces the insulin resistance, fasting blood sugar and controls the HbA1c. But it is important to keep in mind we have to choose the plain type of yogurt with no added sugar. The probiotic yogurt usually contains the live active cultures such as the lactobacillus and bifidobacterium, which helps in contributing the healthy gut. The next thing we can include is the watermelon. Watermelon, 1 cup of diced watermelon usually contains 9 grams of naturally occurring sugar. Apart from that, it has antioxidants which is very helpful in cardiovascular diseases. It's understood that diabetic patients are at high risk of developing the other comorbid conditions like cardiovascular problems, stroke and others. So it is important to have a control on these parameters. So the antioxidants definitely will help in controlling the cardiovascular diseases. There are many confusions regarding the dried fruit, whether it will contribute to the elevation of blood glucose level. But definitely including the dry fruit is one important thing in the diabetic diet, because it only contributes a lesser amount of sugar compared to the fresh fruit. Among the dried fruit, the prunes are the ones with the lower sugar content. It usually contains 3 grams of naturally occurring fiber also. Not only that, this prunes helps in protecting the bone mineral density, as we know that many of the women population are highly prone of developing osteoporosis along with diabetes. Therefore, by giving or including the prunes in diet, improves the bone mineral density and thereby reduces the risk of developing the osteoporosis. The other fruit that can be included is the mangoes. And when you choose the mango, keep in mind to choose the fresh mango, because it increases the satiety, decreases the desire to eat and decreases the glucose levels compared to the dried form. One serving, that is 3/4 cup of it per day, if you include in the diet, it usually provides about 7% of the fiber. Next is the unripe green banana. It is important to include the bananas in the diet because they are a good source of resistant starch. But when we choose the banana, we have to keep in mind to choose the unripe form of it. because the more the ripen the banana, there will be higher sugar content. So keeping in mind this, try to include more of unripe form of banana. Next is the avocado. Avocado is having a 0 gram of naturally occurring sugar per serving. So including this avocado regularly in diet leads to 14% less likely to develop the type 2 diabetes mellitus. And you might have seen in the Western culture, most of the people try to include avocado in the diet. So that this is very beneficial not with diabetes but also in the other health aspect. Now, I hope it is very clear for you what all shall be included in the diabetic diet. So, to have a healthy diet, please follow these instructions. Now, you might think, what all should I avoid during diabetes? Mainly, the foods that are high on the glycemic index scale should be avoided, and these are the list of things that usually come on the higher scale. That is the white bread, puffed rice, white pasta, white potatoes, chocolates, cookies, cakes, potato chips, regular soda, saturated and trans fats, refined sugar, sugar drinks, and salty food. So when you talk about the saturated and trans fat, it is important to understand that diabetic patients are highly prone of developing the cardiovascular problems. So by giving this saturated or trans fat containing food, it will contribute to these kind of cardiovascular risk, and not only that, it will increase the insulin resistance. Talking about the refined sugar, either it be the homemade form of sweets, cakes and biscuits or buy it from the store, it is important to limit the intake of these. As per the American Heart Association, females should consume no more than 25 gram or 6 teaspoons of added sugar per day. In case of males, consuming no more than 36 gram or 9 teaspoons of added sugar per day. When we talk about this recommendation, this does not include naturally occurring sugars from foods such as fruit or plain milk. Next, talking about the sugary drinks, we already know that these energy drinks, coffee, shakes are highly rich with the sugar content. So avoiding that is very, very important. Talking about the salty food, why should we restrict salt content in the diabetic diet is one confusing question. Usually, the salty food raises the blood pressure and thereby affects the diabetes mellitus. We know that diabetes mellitus is associated with various other comorbid conditions or may contribute to the development of various other comorbid conditions. So, as per the American Diabetic Association, the restriction is 2.3 gram per day. Sodium intake is the maximum limit of sodium intake. That's all about the various important dietary considerations to be taken care in a diabetic patient. So I hope it's very clear to each and every one of you and try to follow a very healthy diet. Thank you.